Right now, as you watch this video, your kidneys are working, filtering your blood, removing toxins, keeping you alive. But here's what nobody tells you: your kidneys can quietly lose 90% of their function, and you will feel absolutely nothing. No pain, no alarm, no obvious sign, just slow, silent damage until the day it's too late to reverse. 850 million people worldwide have chronic kidney disease. That's more than diabetes and cancer combined. And the majority of them had no idea anything was wrong because the symptoms feel completely ordinary. Today, I'm going to show you five of those symptoms. Things you have probably experienced this week, things you may have brushed off as stress, bad sleep, or getting older. Stay with me because one of these signs might already be happening to you. Before we get into the signs, I need to explain something that your doctor almost certainly has never told you, and it changes everything. Your kidneys have what scientists call a functional reserve. Even if one entire kidney is completely destroyed, the other one can compensate. Your body will still function normally. You will feel fine. This is the terrifying part. The kidneys only start sending distress signals when they've already lost the majority of their capacity. By the time you feel obviously sick, the damage has been building for years. Medical science calls the early stage of kidney decline the silent phase. And that's exactly what it is: silent, but not invisible if you know what to look for. These are the five signs your kidneys are struggling, hiding in plain sight. Sign number one: extreme fatigue that sleep doesn't fix, especially in the afternoon. You slept 8 hours, you woke up exhausted, you drink coffee. By 2 p.m., you feel like you've run a marathon. You blame your job, your diet, your phone screen at night, but here's what's actually happening inside your body when your kidneys are struggling. They stop producing enough of a hormone called erythropoietin, EPO. EPO is the signal your body uses to tell your bones to make red blood cells. Fewer red blood cells means less oxygen delivered to your muscles and brain. Less oxygen means crushing, unexplained fatigue. This is called renal anemia, and it's one of the most overlooked early signs of kidney disease. It doesn't feel like a kidney problem, it feels like burnout. If you are tired all the time and you cannot figure out why, your kidneys deserve to be on the list of suspects. Sign number two: swollen ankles, feet, or puffy eyes, especially in the morning. Do your shoes feel tighter by the end of the day? Do you wake up with slightly puffy eyes before it fades away? Most people blame it on eating too much salt, flying, or a hot day. Your kidneys control sodium balance. When they begin to fail, they lose the ability to properly excrete sodium, and where sodium goes, water follows. That excess water gets pushed into your tissues, your ankles, your feet, around your eyes. Now, this swelling is called edema, and it is one of the kidney's most common early distress signals. The dangerous part is that morning eye puffiness that disappears after an hour is easy to dismiss as a bad night's sleep. But if it happens consistently, your kidneys may be leaking protein into your urine, a sign of early damage called proteinuria. Press your thumb firmly into your shin for 5 seconds and release. If the indentation stays off, that is pitting edema. See a doctor. Sign number three: foamy or bubbly urine, or needing to urinate more frequently at night. This is the one most people are too embarrassed to mention to their doctor, but it could be one of the most important things you ever look at. Healthy kidneys act as a filter. They keep protein inside your blood and let waste pass out through urine. When the filter is damaged, protein starts slipping through, and protein in urine creates bubbles. Persistent foam that doesn't disappear after a few seconds is not normal. The second sign to watch for: waking up 2 or more times a night to urinate, called nocturia. As kidneys lose concentrating ability, they can no longer hold urine through the night the way healthy kidneys do. Most people blame it on drinking water before bed. It is worth getting tested. Both of these signs are detectable with a simple urine test that costs almost nothing. I'll tell you exactly what to ask for at the end of this video. Sign number 4, persistent itching with no rash, especially on the back, legs, or arms at night. You itch, there's no rash, no bug bite, no allergic reaction you can identify, it just won't stop, especially at night when it's worst. When kidneys fail to filter waste properly, a substance called urea builds up in the bloodstream, a condition called uremia. This urea gets deposited in the skin, where it triggers the nerve fibers that cause itch. Not a surface itch, a deep, under the skin itch that no cream or antihistamine can touch. Doctors often chase this symptom for months, prescribing skin creams, allergy medication, even antidepressants, before ordering a kidney function test. If you have chronic itch with no skin cause, insist on a blood test called creatinine and GFR. Those two numbers tell you exactly how your kidneys are doing. Sign number 5, difficulty concentrating, memory lapses, or a persistent feeling of mental fog. You walk into a room and forget why. You reread the same sentence 3 times. You feel mentally slow in a way that coffee doesn't fix. You blame age, you blame stress, you blame your phone. But the brain is exquisitely sensitive to the chemical balance of your blood. When the kidneys lose their filtering ability, waste products, including phosphorus and urea, accumulate. This chemical imbalance directly affects how neurons fire and communicate. The result is what neurologists call uremic encephalopathy. In mild early forms, it shows up as brain fog, poor concentration, and memory problems. This is also why kidney patients frequently report depression and emotional flatness years before a formal diagnosis. The brain is under chemical stress, and nobody is looking at the kidneys. Here's the most important thing I want you to take away from this video. Kidney disease is almost entirely reversible, like if caught early. The same disease that silently destroys kidneys over 10 years can be stopped in its tracks with one blood test and one urine test. Ask your doctor for these 2 specific tests. Number 1, serum creatinine with EGFR. This measures how well your kidneys are filtering your blood. Number 2, urine albumin to creatinine ratio. This detects protein in your urine, the earliest sign of kidney damage. Both are inexpensive. Both are often overlooked in standard checkups. Ask for them by name. If you found even one of these signs familiar, please send this video to someone you love, because the people most at risk are the ones who feel the most fine. That is the cruel design of kidney disease. If this video helped you, subscribe. Because next week, I'm going to show you the 5 foods that silently damage your kidneys and the 3 that actively heal them. You will not want to miss it.